Okay, so here's some information on this patient. If I want to add to that, if I see the patient today, I open a new and I go to Insert, I go to Previous Note, I pick what I want to insert, and there it goes into the new note. That saves me a lot of dictation. Now, all I do is have to add whatever information I need. So pick up my dragon. See, the above named patient was seen today. Dragon has gone to sleep. Period. He is a little confused. Period. Next paragraph. Examination reveals an elderly patient. Period. His blood pressure is 120/80, period. New paragraph. Examination of the central nervous system reveals a conscious, alert patient, period. He knew the day, the date, the month, and the year, period. His speech and language functions are normal, period. He could not subtract 7 from 100, period. He did not know the name of this hospital, period. So that way you can go on. And Dragon is pretty effective. You've got to speak slowly and very carefully. I've had to train myself to be able to speak clearly. For example, it will not recognize my voice as, my name is Ivor Nazareth. So if I say, new paragraph, Ivor Nazareth. We'll pick that up. If I say Ivorgi Nazareth, it'll pick it up. So you've got to learn Dragon's quirks, and Dragon has to learn your quirks. I guess it's like getting married. You've got to learn what the other partner does. Sure.
What if you've seen a female and you were saying last menstrual period? What would it do?
Last menstrual period.
How does it know the difference?
What?
Because you were saying period and it was doing dot.
Oh, because it's context related. So if you say it in single word, it comes out as a series of words. If you say a single word, period, it comes out as a period. So, for example, if I want to say ANA, 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 see, comes out different. So this is what you've got to learn with Dragon, that it has to be context related. You've got to speak at a certain pace. And once you get used to the pace, you'll know what it'll do for you. So this is just the learning curve that you pick up. And if you have problems, for example, if I say 10, it at once picks up the font, 10. The patient is a tall man, he is 10. It's not doing this now, but it'll pick up the font and go directly to the font. So you press the shift key. When you press the shift key, Dragon then understands that is part of the dictation, and you don't want to go to the box up there. It won't go to 10. Okay, so this gives you an idea of what Dragon can do, and I'll go to another patient and no HIPAA laws. Yeah. Okay, this patient has lots of problems, and I want to add to this note. So I just pick new and insert. Okay, there we are. Now, when you dictate a note, most reviewing authorities want a note to be detailed. So you've got to break up each paragraph to address each individual symptom. And if you want to detail a detailed note and code for the highest note, you've got to have at least 3 items. It's like this Chinese food, 3-item plate when you order Panda Chinese food. So you ought to have 3 items, say headache, neck pain, and back pain, or stroke, headache, obstructive sleep apnea. Put them in separate paragraphs and expound on them. So when you have to add anything to a new patient, now this patient has come up with something new, has memory problems, behavior disturbance, and has a pacemaker inserted. So I've got to add a new note. So the pacemaker will come here after the first paragraph, which addresses cardiovascular conditions. Next paragraph. The patient now presents with a history of a pacemaker being inserted. That if came because I pressed this too early. Period. His pulse dropped to 30 per minute overnight and he passed out, period. So if I don't want to use that paragraph as a first paragraph, I just highlight this. And I want to push the paragraph ahead to make it the main presenting symptom. There, that comes as the first symptom. So this way, the note does not look like it's just copied and pasted from the previous report. So whoever reviews the chart will find there is some difference between that. So cut and paste works very well with charts. There are templates that are available here, especially reviewer systems, and this is one of them. I'll just do it again and show you. So I go to the insert, I go to template, extended search. This is a demo, so it didn't work here, but I got my reviewer systems. I just put insert, and then it's inserted. And then I just correct and see what has to be corrected. If this patient has diabetes, I just take this off. Just with the delete button, that's gone. So that way you can change your note quickly. You don't have to dictate everything. Okay. When I have to sign, you just sign. And I think the code for this is 1, 2, 3, 4, 5. And, so that saved the note. Now, once a note is saved, if you want to edit it, it will it'll put a time date down below here. And if you want to edit it, it'll let you edit the note, but it will add another line detailing detailing the time and the date you edited. For example, if I say, the patient now presents with pain in the right upper limb. So if I say okay, it'll put a timestamp on it showing that I've edited it. So I can't change things on the program without this appearing. And when I first used Dragon, I found I had to introduce many lines here. I'd always pick up mistakes. I was using this laptop, and I really couldn't see the small print. When I used a bigger screen, things became easier.